Recently, a few patients and their families, and the physicians and staff from the North Shore Medical Center Surgical Weight Management Program all got together for a reunion of sorts to share stories, support one another, and celebrate newfound hope. Since 1999, North Shore Medical Center has performed more than 1,000 weight loss surgery procedures. It's the largest program of its kind in the North Shore, awarded the highest rank of Level 1A Bariatric Surgery Center by the American College of Surgeons. But this is about a whole lot more than surgery. It's about more than losing weight. It's about being healthy and changing the lives of everyone around us. The program starts with personal counseling and a thorough evaluation process. Patients learn about gastric bypass, lap band, and sleeve gastrectomy, and which surgical procedure is right for them. They meet the physicians and staff who will be beside them every step of the way. And they get to know some of the people who've already been through the program. There's Kurt Brigham, right there. He was inspired by his wife, Debbie, and his 4 kids. That's Tyler. It had been years since Kirk had been able to run around the backyard. He'd been wearing big, baggy shirts and husky jeans since he was a boy himself. Kurt had problems kneeling, bending, even just walking, which, as you can imagine, makes doing your job a big problem, especially when you're a paramedic. And at night, his sleep apnea required he wear one of those, as he puts it, sexy breathing masks to bed. Kirk had a gastric bypass procedure in May of 2008. Today, he's lost 160 pounds. He's able to do whatever it takes to help his patients, like running upstairs 2 at a time. He's wearing clothes that fit him a whole lot better, and his sleep apnea has resolved, so he doesn't have to wear that mask to bed anymore, which Debbie appreciates. And speaking of Debbie, she's starting the process herself right now, inspired by Kirk. This is Erin James, and she is awesome. Ask anyone. Ask her mom, Cheryl. Erin wasn't asking for much. She wanted to enjoy shopping for dresses, sitting in a seat at a Sox game. She wanted to go on a date. In a little over a year since Dr. Bernard Benedetto performed her lap band procedure, Erin's lost 140 pounds. Recently, her boyfriend asked her to marry him. If you think she's smiling now, you should have seen her last week when she was trying on wedding dresses. And Mom? Inspired by her daughter, Cheryl James had a procedure herself, and to date has lost 85 pounds. Her blood pressure is back to normal. She's running in 5Ks. She's going to be mother of the bride. Dr. Benedetto worked with both mother and daughter, and countless others. He and Dr. Rick Buckley, who pioneered the NSMC program, take great pride in being on the leading edge of bariatric surgery and using minimally invasive techniques that reduce the physical impact on the patient, while making a huge positive impact on their health and happiness. Annie Donavaro had the gastric bypass procedure in 2002. Today, she's 260 pounds lighter, happier, and healthier. She's going to amusement parks again, riding every single one of the rides. She flew in a plane for the first time, and she landed a really great job. After volunteering to talk to new patients at information sessions and support groups, Annie now works for the program. Melinda Vitoro is one of the program nutritionists. She teaches patients like Annie how to overcome the cravings. She gets them thinking about food in whole new ways, keeping things interesting and fun. The things Annie's learned from Melinda, she draws on daily. The two have become much more than patient and nutritionist. They've become friends. From beginning to very happy ending, nobody goes through this process alone. North Shore Medical Center's unique follow-up program includes support groups, nutrition and lifestyle education, exercise and stress management resources. In addition to significant long-term weight loss, patients see an overall improvement in their health. Blood pressure, cholesterol, and blood sugar levels drop. Sleep and mobility problems improve. And self-esteem is off the charts. 2 to 3 years after surgery, the average patient has lost and kept off 109 pounds. And the average gain in energy, confidence, new friends, and newfound hope? Well, that's immeasurable. That's the power of us.